Good afternoon, everyone. This is Dr. Lenny Izzo. Continuing with the series, Getting to the Point. Haven't been online for a few weeks, however, I'm back. And I wanted to address, particularly this month, this topic is on getting to the point on healing. This is, nationally, this is October, Breast Cancer Awareness Month. And so I wanted to talk just for a few minutes about this issue. And then offer you, those who are watching, whether you're in the area or you're outside the area, an opportunity to discover, discern, uncover, become aware of the information I'm going to talk about. There's so much of a very real concern about cancer in our culture, in our society, and there are different views about it. And what I'm presenting to you in the next few minutes is obviously my view, and what I can talk about in a few minutes is not the whole view. However, it is a very important hub of the matter, a very important focus, you could say the bullseye of what actually is causing or underlying cancer. From a conventional model, those of you who are aware, the wellness warriors out there, not warriors, but warriors, you wellness warriors are aware that the conventional model addresses the crisis once you're in the crisis. And this is one of the hallmark differences between the complementary, or what's also considered an alternative way of thinking about our health, and the conventional model, which is not traditional. Traditional healing and traditional technology are those ancient, more ancestral approaches to healing, such as acupuncture, deep energy healing, traditions that have been around for hundreds of years and have emerged out of the ancestral way of looking at health, which has been more of a global perspective. So when we talk about traditional healthcare, personally, I'm not talking about conventional healthcare. Conventional healthcare is not healthcare. Conventional healthcare is disease recognition, disease diagnosing, and then treating the symptoms. Traditional and complementary, which has also been considered alternative, is the approach that I've been taking for 35 years. And it's really not alternative. It doesn't have to be either this or that. It really is complementary. So traditional medicine or traditional healing, complementary healing, and what's been considered alternative healing is what fully has emerged today. And this is where I'm coming from in this video and all the videos that I do that relate to getting to the point on healing. So breast cancer awareness. Typically that means getting a mammogram and maybe taking some written test that determines whether you're genetically predisposed, or taking a blood test to determine whether you're genetically predisposed. And that's pretty much the awareness factor. When we come from a place of energy medicine and what's called functional medicine, and functional medicine includes energy medicine, or can include energy medicine, but functional medicine is really understanding the composite of factors that are underlining all disease, not just cancer. And relative to cancer, and breast cancer in particular, I'm going to discuss the principal factors that lead a person to the end result of their body cancering. 70% of women who have breast cancer have the oncogenes for it, or 30%, correction, 30%, approximately 30% of women today who are acquiring this diagnosis, which means you're already in the crisis, are genetically predisposed which means, what about the other 70% that are not genetically predisposed, but that are also acquiring the diagnosis? What causes the diagnosis should be the question, not how do we become aware of a woman who's in crisis by measuring or screening through a diagnostic test that will only show you the problem once it has already started to manifest, or let's measure the genetic predisposition in which 70% of the time it doesn't make a difference anyway. So as much as we think we are looking through a lens that is advanced medicine, it is not advanced relative to what's on the fringe. And the problem is that what's on the fringe is not yet accepted by convention, and unfortunately most people accept the conventional word as being the truth, as being the end-all or be-all, and it's not. And so you wellness warriors out there are responsible to get the information and to measure that against your belief and your inner truth and your inner guidance, and take responsibility for yourself. Women out there who are listening, you are responsible to take responsibility for your health, and particularly to push against, I wouldn't say fight against, but I would say confront the underlying issues relative to what leads to a diagnosis of breast cancer today. So I'm going to quickly go through this, and then I'm going to make an offer for those who are listening. Become aware. If this is Breast Cancer Awareness Month, then let us become aware of what really causes breast cancer. And anything I say, Google it, look for it. It's in the literature. It's in the fringe research. 10, 15 years from now, these will be moot points, because it will be well established that what I'm talking about here will be accepted as the underlying factors. The fringe is usually 20 years ahead of where the conventional thinking is. That's part of the problem today. So, what causes breast cancer or any cancer? Whether we're talking about breast cancer or prostate cancer or any cancers, the underlying causes are the same. Contributing factors, mitigating factors, environmental toxins. Today we have created an environment that we can no longer live in, and now the environment is living inside us. And environmental toxins are pesticides, herbicides, fluorocarbons, the whole, carbon-based environmental toxicity, where we've manipulated the natural hydrogen carbon chain to create a world of tons and tons of environmental chemicals that we have put into the environment that now is part of the environment. Herbicides, pesticides, arachicides to work with flue mites, fungicides. It is not just in the environment, it is in our foods. And then you take all the chemicals that manipulate so many of the, particularly the unstable, what's called the halogens, in the, those of you who remember high school chemistry, fluorides, your chlorides, your bromides, all of these unstable molecules that are part of the environment, and once they get inside of us, they create instability very quickly. And there you get that redox, that reaction that goes on. And that's the purpose of high consumption of healthy antioxidants, is to counteract that redox equation that's going on chemically inside, where our cells are breaking down at an accelerated rate because of all the toxicity. And it all comes down to exchange of electrons and exchange of what's going on at a quantum level, because that's who we really are. So environmentally, the elevation in all cancers, particularly breast cancers, and I see this in my practice, especially with the assessment tools that I use, that that through the bioresonance technology of scanning, we can look directly, energetically, frequency-wise, right into the lymphatic system, the mediastinal lymphatics of the breast, the tissue of the breast, the lymphatics of the whole body. We can see where the body is holding in the blood system, in the tissues, environmental toxicities. And if it is, you want it out. You want it out of your system. Next is pathogenicity, viruses. In my experience, I have not seen a woman who's had breast cancer or any kind of cancer without there also being a viral burden underlining it. But it doesn't have to just be viral. It could be viral as a pathogen, many different types of bacteria that we hold in our systems are pathogens. I offered a blog video post a couple months ago on the downside of antibiotics and how antibiotics pushes pathogenicity deeper into our systems and into our tissues and ultimately into our cells. Pathogenicity, viruses, bacteria, all sorts of bacteria that we can identify and bacteria that we still don't have the ability to identify because they're morphing so quickly. They're adapting to all of the antibiotics that exist within our environment and exist within us. Then you have fungal issues. Fungal issues today is epidemic. Anybody that sits with me and goes through an assessment with a bioresonance scan, the question isn't, do you have an issue of pathogenicity? Do you have an issue with a fungus underlying infection that the body is not addressing, or viral infection, or a parasitic infection, or a bacterial infection? The question is, do you know where you're holding that infection? Do you know where you're holding the environmental toxins? It's not a question as whether you do or you don't. The question is, where are you holding it and how are you holding it? And what is it creating? What cause is it creating? What is it causing in your system? Are you close to crisis? Are you close to that biological crisis? Are you close to an immune confrontation? Or is your immune system completely unaware of what's going on? And that's the biggest issue today, is our immune systems have adapted to what I'm talking about. So the first line of defense, that warrior on the wall relative to immunity, and what that means is warrior on the wall. What we're talking about is what goes on within the mucous membranes, within the whole digestive tract, within our lungs, and how the environment actually comes through our skin. And where there is a breakdown in the vigilance of the immune system to identify what's going on today, because our immune systems have adapted to what we're carrying. And when you adapt to something that does not serve you, then your adaptation mechanism no longer serves you, which means it works against you. And that's what leads to crisis. That's a very simple explanation of a more complex biological immune issue going on. So decreased immune function. People do not get sick, do not get cancer, unless your immune system has gone to sleep, has become sluggish, has become ineffective. So cancer, as well as all disease, is an immune system deficiency. The vigilance of the immune system has been lessened significantly because of the onslaught, the amount of stressors that we are up against internally and externally today in 2013. And environmental toxicity didn't start today. It started well over 100 years ago. And in the last 50 or 60 years, it is out of control. Estrogen toxicity, a huge one with women who are looking to become aware of where you are at a risk level. I do a test in my office where we measure the levels of toxic estrogens in comparison to healthy estrogens. And if you've been on birth control, you are on birth control, you have any history of pharmaceutical estrogens that you've taken, the chances are that you are at a higher risk. And I don't do the test in my office. I send out to a lab. Metametrics is the lab. It's one of the labs I use. And we can test the ratio of healthy estrogens natural healthy estrogen in relationship to what we now have identified over the last 15 years as toxic estrogens. And these toxic estrogens have to do with a faulty, not just a faulty immune system, but a faulty detoxification system, particularly how the liver detoxifies these unhealthy estrogens in or out. And that's what comes to the next one, decreased nutrient intake. And decreased nutrient intake is epidemic today. The question isn't, are you deficient? The question is, do you know what you're deficient in? Because if you're living today in today's environment, you're not getting everything you need unless you're very, very aggressive in your supplementation. You're not getting it from the foods you eat. You're just not. And there's so much confusion out there. So decrease nutrient intake or decrease or deficiencies in healthy micronutrients and macronutrients. Macronutrients are the proteins, the fats, and the carbohydrates. Decreased deficiency at any nutrient level will affect immune function, and part of immune function is detoxification. So most people today are walking around with faulty detoxification mechanism. You could not be symptomatic, you can be quite healthy, or so you think. Energy medicine, functional medicine, 21st medicine, we have a mechanism or mechanisms of looking through the kind of lens, especially with energy-based technology, that can measure what's happening at these more subtle levels that conventional medicine just does not look at today. And that's one of the biggest issues, is conventional medicine is very limited in what they can see before the crisis actually develops. Last on this list is inflammation. Any of the above will cause chronic inflammation, and there is no disease process, particularly there is no cancer process that will develop in a woman, in her breast, in her tissue, until it has been well established as a chronic inflammatory state. And I told the story in one of the early blogs, 6 months ago, of an 18-year-old woman who had a estrogen deficiency. Once we measured it through a blood test, and a very low ratio. She had a high ratio of toxic estrogens in relationship to healthy estrogens, and she had an inflammatory state going on within the lymphatics of her breast. And when we looked at the probability, which we can do through the database of the sensitive imago, where we took where she was, and maybe she was 22, maybe she was a little bit older, 18 to 22, where she was at this age, and where the process was, which was very preclinical, and simply extrapolated it out mathematically. If she did nothing different, in a matter of 15 years, the probability is she would have come up with a diagnosis. So we can predict, we can manage predictability, and we can predict possibility and say, listen, if you do nothing different, here's where this is at. This is a preclinical stage. But these are the seeds of manifestation of what leads to breast cancer. And so in this month, October, of Breast Cancer Awareness Month, any woman who is within the sound of my voice, who would like to know what these factors are, I am offering a community service where I am offering a complimentary scan. You might think I'm giving this away. I'm not giving anything away. I'm passing on information and giving that information to you. I am donating my time and offering the invitation. And I can also detect these factors even if you are not in the Huntington area with energy-based technology. I could work with someone and scan them through another kind of bioenergetic device. And believe me, these are very controversial, just like the principles and the data and the information I'm giving you is controversy. If you talk to your oncologist or a oncologist, if you talk to the ones at Sloan Kettering, hey, I heard this video by this chiropractor, nutritionist, energy medicine technology practitioner who has been doing this for 35 years, and this is what he said, you can imagine the response you would get. And that's why I started this video by saying, take responsibility in your own hands. What is the risk? Right? Come in to see me. Call my office. Call my office at right now at Centerpoint at 631-547-5433. 631-547-5433. This will be posted on lennyizzo.com for the month of October. If you are a woman who is proactive, I am willing to work with you and offer you a complimentary exam. It will take about a half hour just to look at the lymphatics of the breast, to look at the lymphatics, to look at liver function, to look at a few major systems. It's not a complete body scan, which would take about 45 minutes to an hour. This will take about 15 minutes to a half hour tops. And I'm offering that in October for anyone, any woman, obviously. I offered this to men about prostate cancer about 4 months ago. Men are a little bit more sluggish when it comes to taking care of our health. So I invite you to step up to the plate. I invite you to step into the arena of awareness, increased awareness, and I do that through education. I do it through the tools and the technology that I use, and video blogging, and getting this information out is one of them. So call my office if you have any questions. Get in touch with me. Go to lennyizzo.com. Look at this. Pass this on to friends. Get the word out. If we're going to really step up, and if we're putting ourselves out there and saying, hey, this is Breast Cancer Awareness Month, then let's become aware of the problem before it becomes the problem. Doesn't that make sense? It makes sense to me. So this is Lenny Izzo saying thank you for joining me, getting to the point on healing today, and healing specifically around the issues of breast cancer, which is epidemic, particularly out here on Long Island in the New York area. Thank you for showing up. I'll see you next time.